Imagine reliving your worst nightmare over and over again. Every sight, every sound, every memory dragging you back into a place that is pure terror. Well, this is what affects millions of people around the world who are actually suffering from post-traumatic stress disorder or PTSD. But what if I told you that the battle isn't just in their minds, but it's deep within the intricate circuits of their brains? Join me as I unravel the mysteries of PTSD, exploring the clash between the medial prefrontal cortex and the amygdala, the emotional tug-of-war that fuels fear, guilt and isolation. From hyperactivity or emotional numbness, we dive into the neuroscience behind these symptoms, revealing how recent research is actually shedding light on the brain's hidden networks. Stay tuned, because understanding PTSD is a first step towards conquering it. And later on, I'll be sharing with you some of my top tips of how to actually battle and overcome some of the worst parts of PTSD. Now, post-traumatic stress disorder, or PTSD, is a condition that develops after someone actually experiences a traumatic event. So yeah, I don't actually suffer from PTSD, but someone very close to me actually does, my partner. And I've actually had it twice now. So I know firsthand actually how it affects. Now, they got it first of all by being one of the first responders at the Ariana Grande concert at the Manchester Arena bombing. And they were there for hours helping people who were going through that traumatic event, so much it actually left them with trauma as well. Now, they had it undiagnosed for a few years, and then 2.5 years ago they actually suffered from a subarachnoid hemorrhage on the brain, and that left him with 18 hours of memory loss, and then that was even more PTSD, the fear of what had happened, what didn't happen. And now he's actually got that diagnosis. So for the last 2.5 years, I've been helping him actually overcome the issues, along with the actual therapists that have actually been seeing. So what you've got to remember is that PTSD, it isn't just through that sort of thing. So it could be when you've actually been in a vehicle accident, experience some violence. It could either be towards yourself or towards somebody else. So like with my partner, it could be a bombing, or it could be a shooting. You know, you hear about all the shootings that have been going around, terror attacks. It could be through someone experiencing rape as well. So it's lots of different things that can actually cause PTSD. And it involves the occurrence of intrusive symptoms like nightmares, distressing memories, or fear that link to the trauma and make the person feel like they're actually reliving aspects of that traumatic event and they can't stop it. These symptoms then lead to them avoiding certain situations and things that remind them of that trauma. PTSD may cause various other issues as well, such as difficulty sleeping, negative emotions like fear, guilt, sadness, trouble concentrating, irritability, and even having the worst one, which is survivor's syndrome, if they've been in a very traumatic event like a bombing or a shooting or a terrorist attack. Although the neurocircuitry underlying PTSD is still not completely clear to scientists, one supporting hypothesis suggests that PTSD involves decreased activity in the medial prefrontal cortex and actually increasing activity in the subnuclei of the amygdala, and that's actually involved in the identifying threats. And it also actually deals with the fight and flight part of our brain. So according to this hypothesis, the medial prefrontal cortex normally acts to regulate the amygdala function. It inhibits it when it's not in actually any immediate threat to devote any attention to it. But an individual with PTSD, however, the amygdala might be hyperactive and provokes a fear reaction in response to trauma-related stimuli. The medial prefrontal cortex then fails to inhibit this unnecessary amygdala activation, causing patients to experience responses that are disproportionate to the threat that actually trauma-related stimuli currently poses. Some patients with PTSD, however, also experience a suppression of emotions, which causes symptoms like social detachment and emotional numbness. This might be caused by an opposing mechanism where increased activity in the medial prefrontal cortex dampens activity in regions such as the amygdala and other areas involved in emotional expression. Thus, the neuroscience of this disorder is complex, and the neurocircuitry involved likely depends on the symptoms a particular patient displays at the time. Additionally, more recent research has suggested a role for other networks that span larger areas of the brain in bringing about the symptoms of PTSD. So, now that we've actually looked at that, if you've been suffering from PTSD or you know somebody that has, pop it in a comment below and let us discover what other things actually have got people to have PTSD. Let's share those experiences with others and actually build that awareness for people around there. Right, so now we've done that, let's now look at some of my top tips of actually helping someone with PTSD. And so these can actually help them to understand it and then practice their willingness to navigate their experiences and help them overcome the worst parts in their life. So, number one, educate yourself. Learn more about PTSD, its symptoms, how it affects individuals. This can help you better understand what your loved one is actually going through and the best way for you to support them. Number two, listen and validate. So you need to have some active listening. Offer a non-judgmental ear to them. Let them share with you their experiences and their feelings without interrupting them, and offer them unsolicited advice. Don't judge them. Acknowledge that their feelings and experiences are real for them, and then let them know that their emotions are. Number three, encourage them to get some professional help. Suggest seeking help from a mental health professional who actually specialises in trauma. Therapies like CBT or cognitive behavioural therapy, or the eye movement desensitization and reprocessing, or EMDR as it is, has actually been found to be some of the most effective ways of helping someone with PTSD. Offer to find them the help of a therapist and accompany them with their appointments so they don't feel so fearful. Number four, create a safe environment in your home. Make sure that it's stable, it's warm, it hasn't got lots of bright sounds around that can actually create them to scare them. Have that safe space so it's free from those triggers and sensors wherever possible, and they've actually got places where they can just shut themselves off and just de-stress themselves, away from other noises and sounds. So, number five, be patient with them. Recovery from PTSD is a long process and has many ups and downs. Some days they'll be the best ever and it'll be like the old person is there again. But then the next day they can be the total opposite. They might not want to get out of bed, they don't want to get dressed, they don't feel like eating, they just want to be on their own. Be patient with them and let them do it. Sometimes that's all they actually need to be able to just get over the feelings that they're going through. They need to process it themselves and use their own little ways of coping with it. Understand that those setbacks are part of the recovery process. PTSD, you can't just go and it's cured. You cannot do that. It will not happen. So now on to number six, encouraging self-care. Encourage activities that promote relaxation and well-being, such as exercise, and I don't mean going to the gym, I mean things like just going out for a little walk. Go to walk in your local park, or if you live near a beach or a forest, just do that. Just get yourself out of the normal place. Encourage meditation. There are lots of meditations out there. We're not talking meditating for hours on end. Just a 5-minute meditation every day can make a huge difference for someone who's suffering from PTSD. Encourage them to do any hobbies that they like, or even start some new ones. There are lots of hobbies out there that will actually be helpful in relaxation. It's actually something I'm going to do in a future video. Also, think about mindfulness as well. So that is when you're purposely going out or staying in and just listening to your body, looking at your breathing, thinking about possibly doing yoga, even having something like a fidget spinner. That can actually help. We're just sat there, just spinning that, watching it, and that can actually help with relieving some anxiety. I always have one of these near me. My partner has always got a fidget cube around them. I have actually just recently done a video on my 3 favourite fidget gadgets, and I've done a review on them. That'll be posted next week, so keep an eye out for that one. So if you want to know about when that one comes out, please subscribe to the channel and like it, and then we'll let you know when those new things come out. Then, number 7, respect their boundaries. Allow them to set the pace for conversations or things to do. You know, you've got to take their trauma into mind. Don't push them into talking or into doing things that they don't want to do. Yes, you can encourage them, but don't push the subject. If they don't want to do it, ask a couple of times. If they say no, just go, okay, what would you like to do? And then let them decide. So respect their space, and if they want to be alone, give them that alone time. Then number 8, offer some practical support. So help around the house a little bit more with day-to-day tasks that they might find overwhelming. So it could be they get very frustrated with cooking or cleaning or running errands. You know, figure out what ones that they're okay with doing and let them do them, and you pick up the slack. Yeah, well, I say the slack, it's not like you're nannying them. You're having that more better support network, that more, it's going back to the environment, the safe environment around for them that we mentioned before. And then be available for them if you've got any particular stressful times, like if it's any anniversaries or that traumatic events. I know that my partner, because it happened at 11 o'clock on a Friday, he always wants to make sure that he's in bed asleep before that time. That's his way of making sure he doesn't have to relive that. And I literally encourage that. I go, come on, time to go to bed. It's Friday. I don't even call it Friday anymore. It's pre-Saturday. And that helps to do that. Number 9, encourage social connections. You know, get support from people around you. So close friends, family members, get them involved. See if there are any support groups out there. I know that can be daunting, so go along with them, because people don't really like talking about what actually affects them and hurts them. But even if they just sit there for the first couple of sessions and listen to other people doing the talking, that can be a big benefit to them as well. And they go, oh, I'm not the only one who's actually dealing with this. There are others, I'm not alone. That alone can make a huge difference to them. So try and support them into doing something like that. And number 10, which I think is actually the most important one of all, take care of yourself. If you're the person supporting someone with PTSD, it does have an emotional effect on you. So ensure that you're looking after your own health so you can help them look after theirs. So seek some support for yourself with those support groups. See if you might need a therapist yourself to help you through it. I know that there's not a lot of help out there unless you go searching for it. Their therapist, their GP is not going to think one iota about you being a support person. I know I've asked for support with help with my partner from their therapist. And they keep on promising, I've never had anything back from them. And they've said, oh, I've got all these little booklets. Don't wait for them, you'll wait forever. Find out for yourself. And this is what I'm trying to do on this channel, is trying to help people overcome any different types of mental health issues. Look at my other videos, have a look, subscribe, like, and then have a little browse through and see if there's anything on there that you might like. There are videos on there, so if you have found this interesting and useful and you want to know more, well, wait, there is going to be a video up here, but also subscribe as well. I always forget where I'm actually going to put the little boxes. Yeah, subscribe and find out actually when we're going to have more videos launched. And like I said, have a browse through. There's stuff on there on medications, there's stuff on meditation as well, ways to de-stress, and some useful tips about mental health as well. And like I said, I'm going to be doing 4 different types of things each month. I'm going to highlight something that's about awareness around a different part of mental health each month. Then I'm going to do a review every month, put different things about meditations on there, and then some other things as well that I can find useful for you. So keep watching, keep liking. Thank you for watching all the way through to the end. And I'll say stay safe and stay happy.